So first, I would like to thank Jen again for her leadership and guidance over the past year. It has been an exceptionally challenging year to serve as president for the organization, but Jen has handled it with poise, professionalism, and by always putting members first while coming up with ways to continue to build bridges, even though we are not physically together as we used to be. Second, I would like to thank the many who have impacted my career in so many ways. Starting with my cousin, Jim Dorosiak, who first introduced me to the concept of pharmacy as a career path to a fresh college graduate working in a molecular biology lab and wondering what in the world to do with a bachelor's degree in science that would let me speak to people instead of talking to my cell cultures and pipettes. And to my fellow pharmacy school students and professors from Midwestern University College of Pharmacy, where I learned the importance of didactic and experiential education, as well as the importance of professional involvement, and where I first joined ICHP. I would also like to recognize and thank my co-residents, friends, and colleagues from Rush University Medical Center and the University of Michigan. I wish I could be with you all in person this year and thank each and every one of you. There are just too many people to name, and the impact of those experiences cannot even be put into words to describe how much they have shaped who I am as a clinician, a researcher, an advocate, and as a person. And finally, my ICHP network. ICHP has become a constant throughout my time in pharmacy school, residency, and as a pharmacist. It is the backbone of pharmacy professionals banding together to advance the practice of pharmacy for ourselves and for our patients. And I think that's a key take-home point from this past year plus. We can't do this alone. There are many ways we interact and impact each other, even when we are not working or meeting side by side. But we have built bridges needed to work together. We have this common network to reach out to, collaborate with, and lean on both professionally and personally. Thinking about the integral pieces of the pharmacy, we have technicians, the gears that keep things churning in many pharmacy practices day after day. We have students eager to learn as well as keeping preceptors on their toes. We have residents striving for additional on-the-job education after pharmacy school, as well as learning how to practice in a variety of new environments. We have pharmacists in many different areas of practice and settings, all coming together to teach each other, as we are seeing over these few days of the annual meeting as well, and pushing the boundaries of new and innovative patient care. Within these groups of collaborators, we have team captains and mentors, both formal and informal, providing history, guidance, experience, and encouragement to continue to elevate the profession of pharmacy. The thing is, we're all in this together, every single one of us. Whether it be compounding IVs, developing clinical pathways, providing education, overseeing clinical trials, planning and organizing conversion of units to care for surging needs, or administration of vaccines. Everybody has an important role to fulfill. Everybody contributes to the greater good of the whole group. Everybody is in. So for those of you who know me, you're not surprised that my theme is a quote from Joe Maddon, who was the manager of the Chicago Cubs during their triumphant World Series win in 2016. Yes, for the first time in 108 years. And Joe Maddon believed in his team members, each and every one of them, whether they were winning a championship or playing day-to-day games. Everybody in. He believed in the message to put the group ahead of the individuals. That Cubs fan eternal optimism helps me to find the silver lining in just about anything. While it's been a bit more challenging the past year, we have shown what pharmacy can do as a profession when we band together. While sports usually make great analogies, I do think an inspirational non-sports story can provide an even better example to demonstrate the great strides that can be made in medicine when everybody is in. There is a local story that depicts the essence of banding together people of different backgrounds and strengths with a common goal. Their goal was to develop an efficient and effective screening test and tracing protocol in order to safely open University of Illinois schools. Not only did they develop an economical and expedient new screening test in record time, but they were able to test it and develop a protocol that will expand access to this test to school systems throughout the state of Illinois using saliva. They had chemists and molecular biologists working with research laboratories at the veterinary school, students and faculty providing test samples, and collaboration with manufacturers of suppliers for PCR testing reagents. Everybody was in. Earlier this year, it was reported that they had processed over 1.5 million tests, had received emergency use authorization, and have been able to partner with 7 high-capacity labs across the state to help process these tests on a larger scale. Over the past year, we've also had large phase 3 trials for vaccines start, finish, and provide data for FDA review and receive full approval for prevention of infection, hospitalization, and death. That timeline is unheard of. Additionally, many others have pushed the envelope by looking to repurpose available drugs and new molecules for the treatment of SARS-CoV-2. Pharmacists, technicians, students, and residents have shown what can be done on the front lines to provide vaccines to the masses while simultaneously caring for those who are more ill and hospitalized for various conditions. 6.64 million people in the state of Illinois are now vaccinated. This is what can be accomplished when we put the greater good of the group ahead of individuals. I have one more example that I threw in at the last minute of what can be accomplished when everybody is in, and that's this annual meeting. The staff at ICHP, along with the annual meeting planning committee, have exemplified the theme for next year by converting this conference to a successful virtual experience in an incredibly short amount of time. This could not have been done unless everybody was in. So I want to give a special thank you to the ICHP staff, Maggie DeMarco Allen, Trish Wegner, Heidi Sunday, Melissa Deardahl, Kim Anderson, Joe Haley, Matthew Smith, and Chris Crank, along with the annual meeting planning committee, Matt Alsbrook, Abby Cahaley, Dan Majersak, Becky Ormond, Marion Pop, Natalie Tucker, Jackie Voss, and the chair, David Martin. I seriously could not have planted a better illustration to kick off next year's theme if I tried. So what will we do next? What can we do next? What do we want to set our focus on to continue to show the world what the profession of pharmacy can achieve and continue to advocate for patient care? There really are no limits when everybody is in.